Good evening and thank you for joining us for KREM 2 News at 6. I'm Mark Hanrahan.
It's good to have you here tonight. I'm Whitney Ward. We start with breaking news at this hour. The Washington Department of Health just released new COVID restrictions that will apply to student athletes this upcoming school year.
Sports Director Brenna Green joining us here at the set. Brenna, this is a big deal because these rules will dictate what student athletes and fans will be required to do.
Yeah, the long and short of it is this. Being vaccinated will make your life a lot easier this year if you're a student athlete, but in large part, masks will not be required for participants regardless of vaccination status. Masks will not be required for vaccinated students at any risk level of sports, and they will not be required for unvaccinated students in low and moderate risk sports. However, in high risk sports, which are basketball, wrestling, and water polo, the rules are a bit different for unvaccinated athletes. Those student athletes have to participate in twice weekly screening testing in order to not have to wear a mask while playing. If participants do not want to do screening testing, then they have to wear a mask. Student athletes in outdoor sports do not have to wear a mask regardless of vaccination status. All coaches, trainers, and support personnel must wear masks for indoor sports, though, regardless of vaccination status. And the same goes for spectators. Speaking of spectators, there doesn't appear to be any rules for them outdoors, but indoors, they have to be seated in family units with groups 3 feet apart. That means no student sections for indoor sports this year. So sports looking a little bit more normal.
Right.
But there's still some twists to it, you say.
At least we're having sports at like normal times this season, right?
Yes,
my goodness.
exactly.
It's a big
so hopefully everything will go as planned. Hopefully we're able to have state championships this year and things of that type, because we were not able to have state championships last year.
Any effort to get back towards normal is a good thing.
Yes.
Thank you,
Feels like
Brenna.
it's been such a long time.
Right.
All right, Brenna, thanks very much. Also just in, letting you know the University of Idaho just announced that it will require masks indoors at the university, and that's regardless of whether you've been vaccinated.
The requirement will be reviewed every 3 weeks and then communicated to students and staff. The school is not requiring COVID tests this year before students return to campus. The school starts, by the way, on August 23rd.
And with travel restrictions now being eased, but coronavirus cases surging, many people once again seeking out COVID-19 testing. But some have told us they're struggling to find a place to get tested, especially one without a long wait.
KREM 2's Ian Smay joining us live from the newsroom tonight with what a local health leaders are saying is behind the testing struggles. Ian?
Mark, Whitney, more people are traveling with places like Canada, allowing vaccinated travelers after more than a year of people being stuck at home. Getting tested is a key part of those requirements, and some people have reached out to us saying they are struggling to find a test in time. But according to the local health leaders, we aren't seeing a shortage of testing supplies. With travel restrictions being loosened, people are finally starting to see their loved ones after more than a year of being apart.
But I'm hoping to go home in a few weeks to see my daughter. Because of COVID, I haven't seen her in 2 years. And they're required to you're required to give a test 3 days before you travel.
With COVID-19 cases still surging due to the Delta variant, many places require a negative COVID test from within the 3 days before your arrival, and most places don't accept the widely used antigen test, instead requiring tests such as PCR or ID Now. But those tests aren't always easy to get quickly.
And my concern at that point was the airline want a test within 3 days. Nobody can offer you a 3-day test. They're all giving you 2 days to 5 days. That's no good when you've paid $2,000 for an airport ticket and you're sat there waiting to go.
According to local health leaders, Spokane isn't running low on tests. Spokane Interim Health Officer Dr. Francisco Velasquez said earlier today that the testing supplies are there.
Despite the increase in testing, because we've seen increased testing, which goes along with the increased number of cases because you have more people to test, we have not heard of a shortage or lack of access of testing.
Velasquez did say that providers may have made changes to how much testing they do and when and where they do it. Kaiser Permanente told us today that they had previously reduced testing hours, but due to the surge, returned to full-day testing Monday through Saturday this week. That's only available for Kaiser Permanente members and requires a doctor's order. Providence told us they haven't made changes to COVID-19 testing and that those with symptoms can go to an urgent care to get tested. They said those results come back in 3 to 5 days, outside of the window needed for most travel. Earlier today, Providence's website listed no online reservations available for its Spokane Valley urgent care, and at one point, the walk-in wait time was estimated at about 250 minutes, or more than 4 hours. MultiCare's website says that to get a COVID-19 test at one of its Indigo urgent care sites, you need to have symptoms or an exposure, and those tests are ordered through an in-person visit. As of this afternoon, none of the Spokane locations listed appointments for today, but some did for tomorrow. Chaz says on its website that any community member can get general testing, but to get a rapid test, you have to have an appointment with a provider. Other options include pharmacies, but they don't seem to be any easier to nail down. Earlier today, Walgreens only listed 2 locations locally with PCR test appointments available for today, one in Millwood and one in Coeur d'Alene. And when it comes to the rapid test accepted for travel, only the Millwood location had appointments. According to the Spokane Regional Health District, some testing locations offer walk-ins, but that isn't always easy either.
Or you can just walk in and wait. And I said, well, what's the wait time? And one of them said it could be 2.5 hours. And I'm thinking, I'm sat here with could be COVID symptoms, and they want me to wait in a waiting room for 2 hours. It's just nuts.
Some urgent care locations offering testing, and going to your primary care provider is also a good idea if you need testing due to symptoms, exposure, or traveling needs. But keep in mind, if you have to book an appointment to get that test, you may have to pay the costs of that appointment. In the newsroom, Ian Smay, KREM 2 News.
Also new this evening, Providence is now the latest local hospital to announce new visitor restrictions as they deal with a surge in COVID patients. The changes will impact hospitals in Spokane and Stevens counties. The main takeaways are that all non-COVID inpatients at the hospital can now only have one visitor per day. Now, outpatient, surgical, emergency, and clinic patients can also only have one family member visitor per day. Mothers in labor, they can have one support person and one visitor during the labor and birthing process, but the visitor must leave 2 hours after delivery. Also, infant and children inpatients may have 2 adult visitors a day, but underage siblings are not allowed. You can read more about all of the changes on our website. Just go to krem.com.
Let's take a look at the most recent numbers out of Spokane County today. The number of new cases of COVID-19 reported today, 218. The total number of cases now sits at 51,302 since the start of the pandemic, and the total number of deaths, 698. Currently, 117 COVID-19 patients are hospitalized across Spokane County.
And the CDC is closely watching COVID infections among vaccinated people and tracking how likely they are to infect others. More than 7,500 people have been hospitalized or died from the virus after being fully vaccinated. But those so-called breakthrough infections are just a tiny fraction of the nearly 167 million people who are fully vaccinated. Also breaking tonight, the FDA is planning to update the emergency use authorization orders for the Pfizer and Moderna COVID vaccines to allow a third dose for certain immunocompromised people who may not have had adequate protection from just the 2 doses. Now, technically, vaccine providers cannot administer additional doses to any Americans under the CDC's current agreement, even if the FDA amends its emergency use authorization. That is, until the agency's advisors formally recommend the move. Right now, it's estimated less than 3% of adults in America have what is considered a compromised immune system, and they do often need additional doses of other vaccines to build sufficient protection against viruses. And as the nation grapples with this additional wave of COVID cases, mostly driven by the Delta variant, several states are taking action. Earlier this week, Washington Governor Jay Inslee announced another vaccine requirement for state employees and healthcare providers. And now they'll have an option, either get vaccinated or get fired. But what does that mean for our local first responders like firefighters and EMTs? KREM 2's Amanda Rowley took that question to Spokane Fire Chief Brian Schaefer.
This vaccine has now been arms for over a year, safely and effectively.
Washington Governor Jay Inslee is requiring state employees and healthcare providers to get vaccinated. Shortly after this announcement, the city of Spokane said it is not considering a vaccine mandate for its employees at this time. Now, this includes the Spokane Fire Department, but how the statewide requirement applies to local fire departments is still being sorted out.
So now we have to go through the complexity of Department of Health to the Emergency Medical Division, our providers, and try to gather enough information to work with our employees to implement that.
Fire Chief Brian Schaefer believes increasing the number of people who are vaccinated will reduce the spread and contamination his staff come in contact with every day, something he says keeps him up at night. Would you like to have the ability to require vaccinations for your staff?
It's not a black and white subject. There are a lot of complexities, and I would hope that people would err on the side of protecting their families and protecting patients. But I also understand that that's not the case, and people don't feel that way when it comes to vaccinating or not.
Is that frustrating to you that the city is not considering a vaccination mandate?
I don't think it's frustrating at all. I think it's a process.
Schaefer says the department could not track how many of its employees are vaccinated because it's a medical procedure. But he estimates by word of mouth about 50% of the department are vaccinated. However, Spokane Fire personnel are required to wear masks on all calls regardless of their vaccination status. Amanda Rowley, KREM 2 News.
Well, the CDC is now also urging pregnant women to get the COVID-19 vaccine as hospitals in virus hotspots are starting to see a disturbing trend. There has been an increase of admissions of unvaccinated mothers-to-be seriously ill with the virus, and expectant women are also seeing a higher risk of severe illness and pregnancy complications from the coronavirus. Now, according to the CDC, a safety study of the vaccine has shown that the vaccine does not increase the risk of miscarriage, but the same cannot be said about women who actually get COVID-19. Doctors are actually seeing cases of loss of pregnancy related to the coronavirus.
We want to make sure that you're getting more to every story, so we made finding the information easy. If you would like to read more about the latest COVID-19 surge in the inland Northwest, including about the hospitalizations and vaccine mandates, just text us the word vaccine to 509-448-2000 and we'll send that information directly to your phone.
Our other big story today, parts of Washington back under a heat advisory. Smoke is expected to return to the area potentially as well. So joining us now to break down just how hot things are actually going to get, we've got Chief Meteorologist Tom Sherry.
So for the third time this summer, we are tracking an excessive heat warning, and we're expected to see temperatures get to at least 100 degrees, if not warmer. At least the air quality is looking good right now. We are measuring in the good range, so that is something to smile about. Your day planner forecast, again, calling for 90s this evening. We're at 98 degrees still here on the South Hill. 66 will be the overnight low. Looks like tomorrow we'll get up to 96. I'm expecting a high of 100 degrees on Friday and 100 degrees again on Saturday. And then a little bit of a cool front moves in Sunday. We'll look for a daytime high of 91. And then big changes for next week as daytime highs are only in the low 80s. Yeah, talking about comfortable summer weather. I'll have that part of your 10-day outlook coming up in a few minutes.
I love the sound of that, Tom. Thank you very much. Still to come tonight, Spokane Public Schools getting ready to discuss the upcoming school year in the middle of this latest COVID surge. When we come back, we'll let you know all about the changes students and staff can expect in the fall.